On behalf of Governor Patrick, I'm very pleased to be here this morning. Thank you, Bob and Jeff, for helping us understand what you want to achieve this morning and for your commitment to addressing this very important, difficult, and somewhat controversial topic. As you know, Massachusetts, you've just heard more than I can say about Massachusetts being the center of innovation, not only in the biological life sciences, but also innovation in many different ways related to the delivery of health care. Our Massachusetts health reform law, signed by Governor Romney, has achieved near universal coverage of people in Massachusetts. More than 98% of people have insurance. And what this means, just to be clear about that, is that it has a positive impact on the people in Massachusetts. It means that more people can actually fill their prescriptions. It means that people can actually engage in preventive services. It means that people can actually now afford, without fear, to engage in life-saving treatments that may have previously left them bankrupt. So by covering people, we know that we're advancing health care not only for the individuals, but for our state, and we're supporting industries represented by all of you. We know, however, that every time health care costs go up, around the country, it actually increases the number of uninsured. And in Massachusetts, what we're facing is a way to sustain the important coverage that we've been able to achieve, but we also are not only looking at cost, we also want to make sure that people are able to access care and that everyone has access to the same quality of care and to the advancements in treatments that are represented by Dana-Farber on this panel, and that everyone has those same opportunities. In order to do that, we need to bring costs down. We spend more than $60 billion on health care in Massachusetts right now, and that is projected to double in just the next 10 years. Many agree, however, on the other hand, that about 30% of what we're spending on health care is either wasted or not delivering the type of value that we should be expecting, and that we can improve the efficiency, quality, and safety of care. As you all are aware, Governor Patrick has identified controlling health care costs, not for the sake of just controlling costs, but for maintaining access, improving quality, and making sure that we're able to sustain all of the advances that we're making in Massachusetts. We must address more than the cost issue if we want to maintain access to care, improve quality, and at the same time bring down cost. It's increasingly clear that the system we have needs to be redesigned, and we need to move away from a fragmented system with uncoordinated care to an integrated system with care that is coordinated and well managed with a bigger emphasis on wellness. So rather than focusing on the price of an admission to the hospital or of a test or of a procedure or how many things we are paying for, we need to focus on the processes of care and clinical practice improvement, improving quality, and improving the wellness and health of the populations we're serving. The answer to this is a value-based system that is focused on ensuring that individuals are getting the best value for the healthcare dollar that they're spending. A system based on value for the patients will align incentives to achieve the outcomes we want, access and quality at lower and sustainable cost. Value in healthcare is not determined by the price of one unit of care and one quality measure, but it's actually determined by the outcome for that unit of care over the entire experience of the patient. For that, we need an integrated system where providers are working together toward a common goal that is based on what the patient needs and the desired outcomes. In order to realize that value, the governor filed a bill last year, a year ago almost, and we're very appreciative of all the work that's going on in the legislature to bring the bill forward sometime soon. But the governor's bill basically builds on what we already see as innovations going on in Massachusetts. We're learning a lot from what the market is already doing. The alternative quality contract. Massachusetts has 5 pioneer ACOs. We expect to learn a lot from that. These are opportunities that we want to take advantage of because, quite frankly, we cannot be prescriptive about how to achieve the best integrated systems of care. We have to innovate, examine, re-examine, redesign, and keep going and making sure that we're going in the right direction. So the governor's bill is a balance between allowing innovation to go on, but making sure that things are going in the right direction and pushing individuals, providers, payers, and others to take advantage of what we're learning and take the risk to innovate. That is part of the problem that we see in the healthcare system. The desire for people to change is there, but often the fear comes from what happens if we don't do it right, or what happens if I don't know how to do it, but my provider in the next community does know how to do it. Government needs to support this type of innovation. I would argue that the industry can benefit from this type of approach to coordinating care and aligning incentives toward the outcomes that I don't think anybody in this room would disagree with. The industry can help providers by approaching their mission with these principles of access, quality, safety, and efficiency in mind, while continuing to advance the science of medicine. We will be better able to pay for these advancements when we are innovative and purposeful in our approach to improving the system for patients and consumers. I would also argue that fragmentation is not only bad for healthcare, but it's also bad for innovation as well, because when incentives in the industry are not aligned and innovations in one segment do not spread to other segments, then we're losing out on all arenas in terms of job growth and lessons learned across the industry. So we also need a system of incentives that support both innovation and broad adoption of innovation that demonstrates value. As we move forward, government will be trying to take a lead in advancing the types of care coordination and incentive-driven payments that the governor's bill represents. We're working very hard in our Massachusetts Medicaid program, the Connector, and across our state employers program to adopt these innovations in a way that is coordinated and purposeful with the other innovations that are going on in the private sector, in the market, so that we in government can learn from those as well. One other area that I want to point out that the governor has addressed in his bill is the need for malpractice reform. We all know that there are a lot of dollars spent in so-called defensive medicine. We believe that those dollars can be better spent toward actually providing value to people, and your industry can help us in that regard as well. So we all, I think, are faced with the same challenge. There is lots of opportunity here to support the industry and encourage continued growth and to be successful in terms of the outcomes that we achieve. So thank you.